Hello and welcome to the NexGen HealthTech Podcast, the space where we explore what's actually working in digital healthcare, from AI in hospitals to real-world patient monitoring and beyond the buzzwords. This is about learning from those shaping the future of care, and what better example than today? I'm joined by Vasilii Tereshchenko. He's the CEO and co-founder of Laymune. In a couple of words, Laymune's comprehensive platform for patient-reported measures, PROMS and PREMS, helps you track health outcomes and improve the care experience for patients. So, Vasilii, big thank you for joining in. I'm sure your schedule is quite busy over there, but very glad to have you, and it's a pleasure for you to join the podcast. And maybe if you would like to have a quick introduction, who you are, what is Laymune doing, how is it shaping the future of digital healthcare, and hear more about what you guys are doing over there.
Absolutely. Well, thank you. First of all, thank you for having me. It's a pleasure to talk, always to talk to you. My name is Vasilii Tereshchenko, and as you mentioned, I'm the CEO of Laymune. By background, myself, I'm a medical doctor, so I did my master's in I did my medical degree in Russia. Then I did my master's degree in Oxford, where I received my master's in pharmacology. And then I kind of decided to switch, to the dark side. I left academia behind, and I actually did business development in IT. Then switched to product and project development in the UK in terms of in health tech as well, where we're working on digitizing NHS. And over the past more than a year, actually, now, I'm working on my own startup. I'm based here in Riyadh, in Saudi Arabia, and we are a digital platform for all patient related matters. We have three main products now. First, as patient reported outcome measures that allows you to understand how much the quality of life of the patient has been affected by the treatment, right? So how is the outcome of the treatment for this patient? The second product is the same, but for the experience. Basically, if the first one answers the question, how are you doing as a patient? So the second one, the experience, is answering the question, how did we do as a healthcare provider, while we were providing care? And the third one is we are working on a national integration called NAFIS. So we work on that product to allow the healthcare providers to integrate with the national healthcare standard. So this is very, briefly about what we do, and I'm happy to talk today about digital health and all things related that might be interesting to your listeners and viewers.
Really interesting stuff that you're doing over there. I think one question, firstly, that I would like to ask you is because you're based in Riyadh. This is really interesting. I think it could be for our listeners and viewers. Is how is the digital healthcare scene over there? Because we are very focused on the European Union, US, Canada, the Western side of the world, but how is it shaped in the Middle Eastern side of the world? Because this is, I think, a market that is rapidly evolving. There's huge investments over there, but I think it's deserved the spotlight that it actually needs, because they're even doing better things than we're doing over in the Western world. And I think they're, evolving much faster. They're building with purpose, I think, which is the most important part of all, which I think we're kind of lacking on the Western side of the view. So can you tell us a little bit more about how things are shaped over there? It would be interesting from a person who's there in the front lines in that region.
Absolutely. This is, and again, I worked with a few healthcare systems, right, in or around. I worked in Saudi Arabia now, I worked in Russia, I worked in the UK, and I also, as a medical student, I participated in medical exchange in Portugal, Croatia, and Uzbekistan. So I saw quite a few healthcare systems. And to be honest, in the Middle East, but in Saudi in particular, it's a very, very interesting situation right now, right? Now, one, there's a will to change the system and to create the system to be the best in the world. So there is a will to do that. There are resources, and it's quite interesting what's happening because, for example, I haven't seen recently. We participated in a conference from Council of Health Insurance, which is a governmental body that regulates all healthcare in the country, and this was a unique event where the regulators, the providers, hospitals, etc., and the payers as the insurers, they were one space talking to each other, finding out what's best. And Saudi in this regard is at a very unique point because people in Saudi Arabia are relatively young, right? So the quarter of population is under 14 years old, and I think I don't remember the exact numbers, but I think 65 to 70% is under 35 years old. So this gives Saudi Arabia a unique time to actually work on a perfect healthcare system to create it whilst the population is still young. So as it ages, they hopefully will have a very good developed system, and they have this leeway that Europe, for example, doesn't have, because in Europe the population is skewed towards the other side of the age spectrum. So in that sense, it is at a unique point from this point, and this creates a unique environment. There are quite a lot of startups, especially in healthcare, that are popping up that want to be on the front line of this care. We have successful models of care, from some of the Western countries, right? Not a single system is ideal, but here in Saudi Arabia, what they can do and what they're doing, they're taking models that work in other places and they adapt it to cultural context and to the country's regulatory environment. So this is quite a unique environment. I'm glad we're here. Actually, it's a very interesting place to be.
This is really interesting what you mentioned about exactly their focus on having a younger generation, which they want to link with technology, so they're set up for their future and how the landscape will evolve in the next years. Where I think the real difference, like you mentioned, in Europe, it's, I think, the other way around. You're trying to adapt a digital healthcare system with a population that's aging, and it's getting to a point where, for example, we have researched a couple of numbers here in the last couple of months. There's a huge shortage of nurses and medical personnel in hospitals in Western Europe. In Eastern Europe, it's even worse. But the problem is that usually from Eastern Europe, people like nurses, the general hospital staff, they're trying to flee to Western Europe for higher pay, and different other causes. But this is an issue I think that Europe still needs to kind of maybe get an example from people in your location who are actually doing things much better and are shaping the landscape in a way which is it's optimized and it's effective for the next generations. And I think this is a big thing.
But yes, that is right. But it's also the problem that Europe is already at the point where the population is aging. So their shift needs to be, they need to shift on the chronic conditions. They need to invest a lot into, they have infrastructure in place. In Saudi, digital healthcare and like healthcare systematization is quite young. So that's why they have this leeway, right? So they have time to develop. So now they can focus on preventative healthcare, on, the chronic conditions before they occur. So this gives them this time that they can use to build a very sophisticated, very good system. And there are initiatives that are being, propelled in the country to do that. So for example, one of the big problems that healthcare systems everywhere around the world face today is information silos, right? So you have primary care, they have their own information system. You have secondary care, they have their own information system. They don't talk between each other. Or you can request, bloods or whatever from the GP. You receive a paper letter that you fill in, or digital letter. It's really hard to operate.
Yeah.
So now in Saudi, there are initiatives to kind of separate the application layer from the data layer. And the data layer would not be siloed. It would be unique, a national database of healthcare data that belongs to you as a patient that you can have access to. And this allows us, right, as a startup or any other startups in the space, to develop applications quickly without affecting the data and without the needing to access the data in different silos. And this, again, in the age of AI, this is extremely helpful to have a central bank of data that you can train the model on for your healthcare applications.
And this is really interesting because just very recently I had a conversation with one of our guests from the Nordic region where we were speaking exactly because in his company it was dealing with very early clinical research, and he said we have so much data, we have a ton of data that we can share, but it's the problem is that governments and organizations and healthcare systems don't know what to do with the data. So what you're mentioning is exactly a solution to this problem, which, as we can see again, I think in Europe it's still a big problem, but I think over there they found a really clever solution to this, which solves a lot of challenges, and it will help evolve the system even further in the next couple of years. In this line, when you mention data, what role do you think automation plays in reducing, for example, administrative burdens in healthcare facilities, hospitals, and different various organizations?
I think this is a very good question, and I think the advancement of AI and automation is extremely helpful for admin, because admin takes a lot of time from all the people involved in healthcare. So automating those things can help both admin and clinical admin, right? So
Yeah.
for what I mean by admin is basically it makes it easy to, schedule appointments, to manage the supply chain with all the, the suppliers. Billing, it simplifies billing, it simplifies reporting because it can automate certain things. And we see a lot of startups doing that. But even more so on the clinical side, automating admin work for the doctor gives doctors more time to actually spend on what matters, on interaction with the patient. And this is something that would not be, replaced with AI. And I know a few startups that do, for example, clinical note taking. So you, as a doctor, you don't trying to type, listen at the same time, and trying to advise something. You actually talk to the patient. The notes are, processed in a systematic way. By the way, if you also it eliminates handwritten notes. I'm a
Yeah.
left-handed. I'm left-handed and I'm a doctor, so my handwriting is double bad. So that eliminates all of those things. And of course, one important thing that this process of automation helps with is patient engagement and communication, right? So you can actually automate certain actions so that the patient feels more involved in the process of care. So let's say what we do, for example, you can automate certain triggering of the questionnaires that patient needs to receive and fill in at certain periods of time. And you as a doctor or you as a healthcare admin don't need to think, oh, I need to look in my EMR or I need to look here to not forget to follow up with this patient. So that helps with continuity of care and in general focusing on what matters.
Yeah, I think that this is an issue that I've seen also from my own personal experience and knowing even people in the medical field. They spend sometimes up to 50% in documentation, for example, especially after surgeons, after a surgery. They need to document exactly what happened. They need to follow up the aftercare. They need to follow up on the patient himself, document that process as well. And this requires a lot of time and effort from their side, which they can dedicate now with digital technology and erase that part and focus actually on the patients, which is their core actual functional thing that they need to do. It's their job. So yeah, these examples are really great. And when we were mentioning all these types of new digital solutions, like you mentioned, for various different cases, for example, in your perspective, what are the top emerging digital solutions which are improving patient outcomes inside hospitals, for example?
I mean, there's quite a few, to be honest, with all the advancements. I think the most important one is the various AI clinical decision support tools, right? So they help you as a clinician, as a doctor, to consider all the possibilities of what's happening to the patient. It also helps you to provide better care at a shorter time. But again, there are a few, there are limitations from the regulatory standpoint, from the implementation standpoint. How does it integrate into the clinical workflow, et cetera, et cetera. But this is definitely something that will be, on top of the healthcare trends as I see it. Another thing that is getting, traction, and we're also exploring the possibility of using it in what we do, is remote patient monitoring and wearables. So, like you have, I have, I'm a geek, but
Yeah.
even that's why I have a lot of gadgets. But even if you look at people around, these more and more people are starting to have, Apple Watch, Fitbit, all those different trackers, and we already collect a ton of information about your personal health. So the question is now, how can we use this information in healthcare? So one such example, for example, we are implementing now. We're working with Al Faisal University on a wearable technology that allows you to assess the patient outcomes, certain aspects of patient outcomes without the patient input. So this adds a bit of a objectivity in a very subjective method, right? So you can measure mobility and various other things. So this is just one example, but there are multitude of ways you can do that. One of the very important things that is also gonna happen is patient engagement. As I mentioned, patients want to be engaged in their healthcare, right? They want their voices to be heard, and the digital tools that allow you to do that will be gaining popularity as well. So through communication, prompts collecting, etc., etc. What else? Digital twins is something, you go to any conference, you see 10 companies doing digital twins, but in healthcare, basically this I feel has a big potential for a few, directions. Personalizing medicine, exploring, digital twins of the hospitals, to kind of predict the effect of the changes that you want to impose on those hospitals before actually implementing them. So those are some of the very big things that I think are very, popular that will help with improving the value and outcomes for the patients and everyone involved in the healthcare.
I completely agree with all your points. I even had recently a conversation with one of the, I would say, locally here, one of the rising young generational talents in cardiology, and we spoke a lot about exactly the patient experience because his approach is, for example, we were speaking even with me. I exercise personally every day. This is something that I'm trying to take care of the body. You know, that's allowing me to do all the things that I do every day. And I also, like you mentioned Geek. I'm the same thing. I have a Garmin watch. I go out running. I track my blood pressure, my heart rate, my VO2 max, for example. And these are things that I can take in, and then I can even go to my, let's say, cardiologist and mention like, hey, these are the stats that I have. Is there any way I can optimize my nutrition, exercise levels, etc., etc.? And he was saying that, for example, with his patients, this is something that he does now on a daily basis. So he integrates, if they're wearing a watch, he asks for the data, he looks over it, and he can mention like, okay, here are some things that we might need to change. Why did you have this blood pressure spike over here? So these are really things that also not just help the patient, but also help the doctor, determine maybe what the causes are for a particular disease, a chronic condition, or how to just optimize health, even if you're healthy. So
At the
completely
same time,
agree. Yeah.
at the same time, it can be slightly annoying for the doctors when the patient comes in and is like, I asked ChatGPT, and that's
Yes.
what it told me,
This is this is a backlash thing where I think it used to be Google, but now you have a very intelligent system like ChatGPT, which can act as a doctor in a lot of cases because you can ask him, hey, I have these types of symptoms, and then he can give you a list of conditions which might fit or not. Yeah.
And by the way, ChatGPT or large language models are very good at detecting edge cases. So
Yeah.
I'll give you an example. You as a doctor, I don't know, as GP operating, I don't know, in Riyadh or in, I don't know, in London, most of your time you deal with, like 95% of your time you deal with a standard set of conditions. Then there are like 4.9% that are slightly deviant. Maybe, I don't know, you ate something
Yeah.
outside.
Yeah.
But there are some edge cases. For example, you go to, Congo, or you go to some other places, and then you come back and you have certain conditions that I am a doctor am not exposed to, right? So it's not on my mind necessarily. I know about them, but they are like somewhere in the back of my mind. So ChatGPT and such, they are very good at detecting those edge cases. And I think there are a few stories on the internet that when it helped to detect certain cases. So you as a doctor, you shouldn't be very opposed, right? It should be an interaction. So your
Yeah.
role as a doctor will change to explaining why is the best, right? So yeah.
I think it's like a balance thing where for example also in my work on a daily basis I do use AI. It's helping me leverage what I do and optimize it and saves me a lot of time so I can do more with what I'm doing. So I think for me personally that's a use case which can be also translated to doctors, for example. It can save them time, it can support them in their process, and they can just use it as a tool as they used to use books, for example, because maybe sometimes, like you mentioned, it's an out of the book case. Maybe he has to go check some records or some books or some, some old study notes that he had in back in university to figure out what's happening with the patient. Now you have AI, which can save you a lot of that time, and I think this is a huge tool that doctors are now have their hands free to use at any time. But while we're speaking about these things, one thing that I really wanted to ask you, because what you guys are doing, I think, as a startup, is really interesting, and particularly your niche topic is something that's not talked about enough, I think, in my personal opinion. What does it take for a startup like yours, for example, to be successful in the digital healthcare field overall? Because I think that there's a lot of startups emerging in this field nowadays, and there's a lot of companies which are trying to do really interesting, innovative solutions to particular challenges. But it also, I think, sometimes maybe it takes a person like yourself to have a medical background. Sometimes it takes a particular team to be behind the project itself. So from your perspective, you've built this from scratch. So what does it take to have success in this field?
We shall see, inshallah.
Yeah.
but because again, as a startup, you're always, striving for the next step. But I would say that there are some things that are common for successful startups across all the fields, right? And it's the right team, it's finding the product market fit, a bit of luck as well. But there are certain specific things that for healthcare startups I think are very important. And one of such things is actually balancing. So as a startup founder, you want to move fast, like bam, bam, bam. We need to, we need to do it yesterday. We need to do this, this, this. So in healthcare, it doesn't work like that. Healthcare requires so especially, I would say, patience, right? So you need to balance your desire to move quick as a startup founder with patience, because you need to you need to get all the regulatory approvals, right, before you can actually process any patient data. B, if you're planning to sell to hospitals, the sales cycles are very long, so you need to plan for those, right? So implementing, there's a resistance from, so think about this from the doctor's perspective. If you're trying to sell something that the doctors will have to use, they're already overworked in most of the world. So you need to think about those things. You need to be patient, to talk to doctors and to explain, okay, we're not going to change, we're going to implement it in your clinical workflow. It will make your life easier. That's how, 1, 2, 3, right? So you need to be patient in terms of, in a lot of things with a healthcare startup. And of course, you need to be creative, because when patience doesn't work, creativity kicks in, right? You can think about how to, for example, how to operate with the license of your healthcare partner, for example, or some other things. So those two things, patience and creativity, are the things that I think, in addition to all of the other ones, Peter Thiel 0 to 1, all those qualities, those are especially important for healthcare founders.
Really interesting. And I think that one more challenge that now a lot of startups face, I think this is a huge, because I'm quite familiar also here in the landscape, how it's kind of evolving in Europe as well. We have a lot of EU-backed funds, for example, for funding. Some companies, even here locally in Bulgaria, are going now to Silicon Valley and trying to find private investors also there, plus VC funds. So it's kind of a mixture, but I think that it's starting to get a lot harder to find funding nowadays, because also it's also from an economic perspective, things are happening and we're shaping into this kind of, I would say, maybe people are not so sure exactly how things are going to be moving in the next couple of years. But how is this in Riyadh, for example? How is it in this part of the world? Is it easier to find funding there? How is the funding process?
Yeah, so I don't know if it's easier, right? Because this is my first startup and I'm doing it here. But in general, I'd say in healthcare in particular, this challenge is very, very acute, I would say. Because in order to get money, you need traction. In order to get traction, you need money. And this is a vicious circle of, how do I prove traction with what I have? And the strategy remains the same. So we, for example, we were lucky to get our initial investment from the Antler VC, which were, you know, again, we were extremely lucky and hardworking, of course, to get it. But the initial investment usually comes from those early, believers. If you have funds that invest in extremely early startups, then it is possible to find the money. But also, it's probably angels. So it's your co-founders' networks of angels that you can rely on to actually give you this little bit of traction before you can actually search for the VC funding. And especially in the region, again, Silicon Valley has the whole infrastructure of startups. They know how to invest. They know the risks, right? So if I'm an investor in Silicon Valley, I know that, I invest, I don't know, $20,000, but I might not see it ever again. Or I might see, 200,000 in 5 years. In the region, I feel this is just shaping up. All right. So they recently opened up for startups as such. And for a lot of family offices or angel investors in the region, they understand traditional business really well. So we do construction or we do other things, but for startups, you need to do some convincing. At the same time, there are more and more funds, there are more and more angels that are educated about the startups that are emerging. So Antler, one of them, 500 Global, they collaborate with Sanabil Investment, which is also a very big firm here. So it starts to change, but it's a bit still needs a lot of convincing and investor education if you want local investors.
Interesting. And are they only looking locally, or they're also looking maybe on a larger scale also for global investments? Because this is something that's also, I think, region-wise, it differs. For example, in Europe, VCs are more focused internally, for example, and within the country itself. This is something that I've noticed.
So yeah, in regards to the in regards to the local versus international investment, I'd say it's a good mixture of both. So I was helping some people to bring in the UK startups to the region, and I see that a lot of startups from other places, they want to come to the region, especially Saudi Arabia, because it's, again, as we mentioned at the beginning, it's opening up. But I also see the appetite from the local investors to invest internationally. So I think it's a more of an international community, and we've seen with the US Saudi event just a few days back in Riyadh, we saw huge amounts of commitment of the local investment into foreign companies, and to foreign companies investing time and infrastructure and money into Saudi Arabia and in the region in general. So I think it's a it's good for everyone, right? So people want to do business here, but it's then again in the face, even with all the the political instability and whatnot, there is still demand for globalization of talent and technology and advancement of technology as such.
It really, really interesting perspectives. And maybe here, I think one thing that we can also maybe just cover very quickly is, for example, all these types of digital healthcare solutions. How can they be personalized maybe according to specific needs in terms of patients, which might have, for example, chronic conditions? Some might even, I'm seeing a lot of emerging technologies also now for example, mental health issues, because this is something that's also, I think, not talked about enough. But how would you say that tools can be more niched to the actual needs of the patient, and how can they be personalized and optimized in that direction?
That's a very good question. I think the advancement of technology and AI in particular allows to almost fine tune your solutions to personal needs of the patients. So for example, I'll give you an example, and there are startups that are starting to do that. So for example, in the UK there is a startup called Euphonia. So what they do, very smart guys, very they do very interesting things. They do voice AI for patients with cataract. So before admitting a patient for cataract surgery, the patient needs to answer a few questions. The way it's done now, you send a yellow paper with black ink on it that the patient needs to fill in. Dude, like if you have cataract, yes, black on yellow is slightly better, but it's still not
Yeah.
great. So what they do is basically the AI system calls the patient, asks the same question, and then populates the questions that needed to be answered. So this is a very kind of unique example, and they receive the medical device, which is also, it's a very unique laser focused use case scenario. And we will see more and more of those, kind of unique combinations of personalized AI for certain patient needs. So as a startup, I think you if you have, again, it's not a value proposition. AI is a tool that allows you to solve a problem. So you as a startup, if you're using AI, you need to identify the problem and think, is AI the best tool to solve this problem? And in a lot of the cases it is, and then this would give you the edge over the competition to personalize your use case for the particular patient needs.
Yeah, what you mentioned in that use case, really interesting. I even had this talk with the cardiologist that I mentioned a little bit earlier in the conversation, where he even said that now they're even doing this research of creating these microchips which are integrated with AI, which can be actually inserted in the veins, in the arteries of the patient, and they automatically extract data of the blood and then just signal it back through a signal into the computer and give you a complete blood work, which is something that I think even 5 years ago we couldn't imagine it was kind of possible. So I think all these very niche personalized solutions are emerging, and they're just about to get developed in the next years. So here, maybe in conclusion, one really interesting question that I want to ask you, that I always kind of ask our guests, is how do you view the digital landscape of digital healthcare evolving in the next couple of years? What could we see? How could we further use AI? And most importantly, I think where this becomes a really important question is, how do we also transfer this knowledge and this approach also to the younger generation, which are going to keep building on top of what we're building over now, for example?
So to be honest, it's a very easy answer, right? We don't Younger generation, they are gonna outsmart you and I. They
For
will
sure,
not
for
need
sure. Yes.
they will not need our help in doing that. But multiple times in my life, a year, you think, gosh, like I'm happy to live in this day and age because we have artificial blood vessels. We can have replace the heart, liver. We can treat a lot of the things that were not treatable before. We understand how brain works much better than we did before. So I think that this, especially with the advancements of AI, we will keep the steady pace of the progress. We will find new solutions to the old problems. We will find new solutions to new problems. A lot of the things that potentially I think we already discovered, for example, something has been discovered, but it's in the journal in somewhere in, in I don't know, Russian language or whatever. No, Russian is spoken by a lot of people, but like by some language that is not spoken by a lot of people, but there's already a solution. So AI will allow us to collaborate on a global scale as a human kind. I'm a idealist, so to say, but it will allow us the current technical progress to collaborate on a global scale on global problems. It will allow us to help solve some global problems. Hopefully, we will be able to treat more kinds of cancer. We will hopefully be able to address neurodegenerative diseases. Right? We will hopefully extend the healthy age of people. So I hope that the pace of the progress will keep up. We will solve more complex problems, unless of course there's World War III, and then we will live in nuclear winter.
That's a great closing remark. I hope it's not the latter. But yes, like you mentioned, I think I would put it also in my own words. I think one of the really interesting parts that I would like to see in the next couple of years is the predictive analysis part. I think this is really interesting because now we have access to a lot of data, and AI can help us analyze this data. And even now they're researching things like how to predict, for example, dementia, Alzheimer's, neurodegenerative diseases, like you mentioned. And this can really change lives of people which are coming on to this world. It can change someone's mother's, father's life, their daughters. This is having a huge impact. So I think a lot of people view AI also as I think still there's this side of the world which views it as the enemy. The technology that's gonna take over their job. Which I think that we need to start looking more from the perspective of how. Yes, it's something new. It's always scary in human history when something new is being developed. Like it was scary to have electricity back in the day. So now it's AI. But I think we need to shift the perspective into thinking like, how does this technology actually help us better our lives and change for the better in the future? Because it's at the end of the day a tool that we can use to our advantage. So I completely agree with your remarks, and really a big thank you for taking the time. I'm sure it's very busy on your side of the world and with what you have going on. So we'll leave some links below when we release the episodes so people can find you and find out more about your startup and what you're doing if they're interested to get in touch with you. And later down the road, we'll be really happy to have maybe another discussion on a different topic. So big thank you for joining in. It was a pleasure.
Thank you for having me. Thank you very much. It's been a pleasure for me too.
Thank you. Have a great day, and thank you guys for listening on the podcast, and let's see you on the next episode. Thanks.